Okay, I'm back. Me and Holden had to go take a quick shower. For those of you dealing with epilepsy and big seizures, you know why. Okay, so this is how we stop these seizures. This works almost every time for us, for Holden, with tonics and tonic-clonics. And this is what happens when he has a tonic. He goes, and he'll seize like this for a minute, sometimes 2-3 minutes, and sometimes it'll go tonic-clonic, right? So he'll seize and he'll scream, and then he'll go tonic-clonic. If we're right there, and we're always right there, he typically has these seizures throughout the night. Nighttime's the worst for him. But as you saw, he just had one during the day. But if we're right there and we can catch him within the first like 2 or 3 seconds of that seizure, we can stop it. So I'm gonna have Kenzie demonstrate. So go into a big seizure, like a tonic seizure, like
this?
Yep, so if that happens, the second that happens, if I grab him and I straighten him out,
Like this.
it'll stop. You keep trying to seize. I just pull, and it has to. If I just disrupt whatever the body's trying to do like that, straighten him out, pull his arms down, put his feet down, it'll stop. Like that. No drug. No cannabis. No side effects. And if it's within the first couple seconds, I can stop it. If it starts tonic-clonic, it takes a little more effort because I have to kind of like do the opposite of what his body's trying to do and disrupt that signal. And it works. Now, again, I'm not a doctor. I'm not giving you medical advice. You don't have to try it if you don't want to. But this has been something that has consistently, instantly stopped that seizure and pushed him into just that postictal, and then he recovers quick. If we can prevent that tonic-clonic, we're going to prevent him from not being able to breathe for 3 or 4 minutes, okay? So if I can stop it like that, he goes back to breathing normal. When we can't stop it, he's in that tonic-clonic for a long time, which means his oxygen, or his brain is not getting the oxygen that it needs. When he's tonic-clonic, he's usually, a lot of his stomach muscles are going crazy, and so it's making him throw up. He has high risk of aspiration. In fact, he aspirates quite a few, so we're always having to have him on his side and make sure the throw up's coming up, and so we're preventing a lot of things. The trauma from the seizure itself. We're preventing lack of oxygen in the brain. We're preventing the throwing up and the aspiration. In fact, that's what put us in the ICU just a few months ago, back in September, was from a tonic-clonic. He had aspirated. That eventually turned into a pneumonia infection. That infection turned into status epilepsy, and we were in the ICU. Since I figured this out, and the way I did is, he used to have a lot of absent seizures, and when he was in an absent seizure, we could hold him and kind of shake him, and he'd pull out of it. And I was talking with not a neurologist, I don't remember what he was, but we were discussing the THC intranasal spray and kind of the mechanism of how it could possibly be working. And he said there's some type of signal disruption going on, and didn't think it was the THC or the CBD. He thought it was maybe the terpenes, the flavonoids, triggering the nerve and doing some kind of signal change. And he asked, have you ever been able to stop other types of seizures with touch or some type of sensation? I was like, yeah. And so that got me thinking, like, what if I change what he's doing during a seizure? And one night he started seizing, and I'd do that. I'd grab his head and I'd straighten him out, and it'd stop, and it'd stop. And I literally stopped like a dozen seizures that night. And when Mandy woke up the next morning, I said, Mandy, I stopped every seizure last night. She said, what do you mean? I said, well, as soon as it started, I'd straighten him out and it'd stop. And she thought I was nuts. And until that next night, and I was like, watch, when a seizure comes, and it came, he started to go tonic, I pulled him straight, it stopped. Then she started doing it, and it worked every time. And now, if we can catch that within the first few seconds, we can stop every seizure. The hardest time we can't do it is if we're in the car and he is seated, and the only thing we can do is straighten his head back, and we can't straighten his body. So if we can catch it quick enough and get his head back, it'll stop. But if it goes for a couple seconds and all we can do is his head, but his body's still going, then it'll go straight on to tonic-clonic. Most of the time, he's walking, we can grab him and straighten him out, or he's laying down, we can grab him and straighten him out. And it works. So just wanted to share all the different things that we've learned with stopping active seizures. So anyway, thanks for listening. Till next time.